So I called you to order. Let us stand up and salute the flag. Dancy, would you lead us?
Sure, be happy to. Place your hand over your heart and begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And now we have another time for public discussion for items not on the agenda. And I do have one piece of paper from Mary Drummer. Mary.
Good evening, everybody. So I'm here to talk about Tessa. So to the board and employees of Beach City's Health District, I'm here to say some kind words about Tessa Garner. We just kicked off my second season of volunteering with the Body Mass Index Project in our grade schools, where I'm side by side with Tessa. She moves seamlessly between teachers, kindergartners, special needs kids, and volunteers. No matter the age or ability, she treats everyone with dignity and respect. She is the embodiment of every principle that BCHD stands for. She can move from supervisor to data input when we're short a volunteer. She greets the children with, "Hello, friends." And when she steps away, we all comment on how wonderful she is. I believe everyone has an innate need to be seen and to know they matter. Tessa, we see you and all the good you bring to this community and this organization. Well done.
Yay. And we will be hearing more about Tessa when she actually gets her Employee Recognition Award. Item number 3 is appointment of board members to Beach City's Health District committees. I have, and I need, as I say your name, to have you let me know if you are willing to serve in that capacity. On the Community Health Committee, we have Dr. Bolot as the chair. You good with that?
Yes.
And Vish as the second.
Yes.
Finance Committee, we have Vish as the chair.
Yes.
And Noel as the second.
Yes.
On policy, we have me as the chair, yes, and Michelle as the second.
Yes.
That'll be fun. Properties, Noel as chair.
Yes.
And Jane as second. Strategic planning, I will be chair, and I concur with that, and Jane as second.
Yes.
Ad hoc Mind Health Committee, which will end in July 2020. It's an ad hoc committee, it's not a standing committee, and that will be Dr. Chun as chair.
Yes.
And Dr. Bolot as second.
Yes.
Okay, so I need a motion to approve the appointments of committee members.
So moved.
Second.
I have a motion from Noel and a second from Vish and other people. Is there any public comment? Any further board comment? All in favor say aye.
Aye.
And any opposed? Hearing none opposed, passes unanimously. Next item, staff recognition. Let's learn more about Tessa. Come on.
Good evening to the board. Carrie Ann Lawson, Chief Programs Officer. It is my pleasure tonight to recognize Tessa Garner for her 5 years of service to the district. It's actually more than that because Tessa is one of our stars who started as an intern here and then worked her way into employment. Tessa's job title is project manager, but I call her the secret weapon because I can deploy Tessa to any department, any lifespan, any project, and expect it to be done with a high level of detail, thoroughness, and excellence. When we, 2 years ago, had a staffing change, I've through the BMI project at Tessa because it was that time of year and it had to be done. And she brought her efficiency, her grace, and as you heard from Mary, all of her skills to working with the school district and entered into that seamlessly while also making changes so it runs at a higher efficiency now than it did when she took it over. I've also had the privilege to watch Tessa grow as not just an employee, but as a person. And I'm so very proud of who she is and who she's becoming as she establishes her voice in our organization and becomes a leader. So I am delighted to work with her every day. And I can't believe it's been 5 years. Congratulations. To say something, but you may.
Well, I really appreciate all of the kind words that you all have said. I really have enjoyed my time here, and I have learned so much and grown professionally and personally, and I just, everybody here is so great, and I learned so much from each person that I interact with and each project that I work on, and I'm just so grateful that I get to be here, part of the community and part of the team, so thank you.
Thank you, Tessa. CEO report, Tom.
Great, thank you. Well, I'd like to start off my comments by also thanking you, Tessa. I see all the different things that you do, and I ask, well, who's working on this? Tessa. Well, who's working? Well, and so I echo Carrie Ann's comments. Thank you for your years of service and keeping things in the family. I'd like to thank Eric Gardner for his service. This is his last day today.
No.
Yeah, Eric has really helped me with my transition over the last 2 years. As you know, I was in local government for 28 years, and we didn't have communications department. We had public affairs, and I was kind of wondering what the difference was, and I now know it's very different. I'm spoiled with the level of service that that department provides, and certainly what Eric has been able to do with writing and helping us up in Sacramento and helping us with the community working group. I announced it to them the other night, and they were not aware, and Dency is showing their sentiment. They were sad to see Eric go. We wish you well in your endeavors, and we're glad that you're going to be in the community still. And you probably thought I was kidding when I said that maybe you would be on the community working group. So, so we'll talk about that later. But at any rate, we did a farewell lunch yesterday for Eric, where staff got to tell stories and embarrass Eric. So we try not to do that tonight, but I just wanted to say thank you for your years of service with the district.
And I'd like to thank you, Eric. You've done an outstanding job. Thank you so much.
Yep, we all second that. Unanimously.
My report is fairly short because most of my time was spent on what you just saw there with the Healthy Living Campus and working closely on that. We look forward to coming back next month. We are looking to do another study session next month where we'll come back with what you discussed in work session and talk about next steps and also talk about the environmental impact review process and also talk about what we learned from the open house that we're looking to have here on campus on the morning of March 23rd. Other things that we just want to give a quick update on that you may hear about is we have changed our grant process. That was in response to Assembly Bill 2019 from the state, where they were looking for more of a process. We already had a process in place. We needed to refine that. You all did that through changing some policies. Carrie Ann and her team, and I think Tessa was involved. Yeah, Tessa was involved with it. Put together a manual that really helps us with our different contracts our micro-enrichment grants, and then our grants that we provide to other agencies. And so that process is happening. Just wanted to give you a quick heads up about that. And then tomorrow, and maybe Lauren's working on it right now, but Lauren and I are presenting to the South Bay Council of Governments tomorrow. We're going to be talking about well-being. We're on the agenda with Rick Cole from Santa Monica. He's the city manager of Santa Monica, where they're doing a lot of work with well-being, and we're going to be talking about well-being and happiness to 350 city officials from the South Bay tomorrow, and talking with them about how they can program happiness and mental health into everything they do. And so we're going to be talking with them about that tomorrow. Time permitting, we may do a mindfulness exercise. We're not sure if we have the guts to do that yet, but we might. We'll see how that goes. You're saying thumbs up from the board? Okay, well, we'll see. Time permitting, if we're able to do
2 minutes.
if we're able to do that tomorrow. So just want to give you an update. I think some of you may be coming to that, and that'll be towards the end of the program, so we don't want people falling asleep, but we'll make sure they understand our mission and what we're looking to accomplish here, and really showing the examples that we already have from some of our city partners. Hermosa's already done mindful minutes at some of their council meetings, and so we're going to show lots of practical examples about how cities can integrate happiness into what they do.
I hear even the American Bar Association is considering it.
Oh, they are? Okay. Yeah. There's got to be a joke there, but I don't think I'll go after that. But so that's just a quick overview. I'm just looking to see. We're going to be getting
influence,
obviously the health priorities is a huge issue, and that's one that we have a separate agenda item tonight coming through one of your committees.
Okay. Next item on the agenda is Monica. Mid-year review. Do you need us to move? Are you doing some slides?
Yes.
I do have a few slides.
Okay.
Only a few, but okay.
I'm stealing this pen, whoever left it up here. So it's yours? Well, I get to use it.
Oh, yeah, I was going to try to use the clicker. If not, I'll do. So, is it kind of working? Okay. Good evening. I'm Monica Sua, CFO, Beach Cities Health District. And I'm here tonight to give us a quick outlook about our mid-year financial health, where we are today as of the middle of the year. And so basically, we're going to try this, but it may not actually work. I suppose, Eric has to. So, so I wanted to give you an overview about where we are first on revenues, and we are basically favorable about $261,000 to our budget, and I'll talk to you about why that is. And for the first portion is actually the legend is on below, so I'll try to. So actually, but I'll change. And my glasses on. Okay. So. Our health and fitness centers are running below their projected revenues this year. They are still ahead of last year. And what they're able to do is also adjust their expenses. So on a net basis, they are still ahead of their budget. And then for property taxes, we're really going right on line with our budget. So we are just estimating to end where we are projecting for this year. For the tenant leases, we are running above where we projected to be, and that's because we have collected above and beyond our building operating expenses, which is reimbursements from our tenants whose building operating expense reimbursements continue to grow, and we know why that is. And so, and then the interest is above the budget, and that is mainly because of unrealized gains. And I'll touch a little bit on this here at the end. And our limited partnership is also a little bit below due to the Sunrise, about 95,000, but they are starting to pick up. As of January, we did have a pickup about 28,000 from them, and we're actually estimating that they'll probably end up right around budget, because the last portion, part of our fiscal year, they actually tend to trend up. So we are thinking that they will catch up their downfall. And we have a small portion of other revenues that is a little bit above budget this year. We collected some from a grant through the Lifespans and Carrie Ann's department there, from the California Mental Health Association. And then we also collected a $35,000 settlement from an old tenant. So, okay, yeah, so we can move on to expenses, and we're also favorable in expenses. And what I wanted to do on this guide is actually just look at total expenses, because each department really is below budget and have some savings, except for the property operations department, and that's because we have electricity as higher than anticipated, plus we do have those building operating expenses that keep coming up as emergencies. We really keep getting all kinds of emergencies to fix in this building, and that just adds up. And so if you click on that actual, we are favorable, and a big portion of that is from payroll, which is through the year we've had some open position leaves, and also the big portion is from the health and fitness operations, who's able to adjust their payroll to their operational needs. So they have a chunk of part-time labor savings there. I think we can move to the last slide. So basically, I'm showing this because we actually have finalized January, and you do have that in your CER report. So we continue to pick up, and it really is, the big portion is from unrealized gains and losses. So we see 643,000 net favorable. About 396 is unrealized gains, and that is a non-cash item. So if they do sell, that is really what, we projected we would get some gains from that. And, at this point, it's not being sold, but the cash benefits then that we are above budget is about 250,000. So that is a true cash item. And that is the quick update to provide you of health of our financial status. Thank you.
Do we have any questions from the board? Next item on the agenda, legal counsel.
Just got a brief update. If you remember a board meeting or so I mentioned that we're going to have, our firm was having a symposium on healthcare policy and law. We had it about 2 weeks ago down in Laguna. Carrie Ann and Jackie were at the meeting. And at that symposium, we also released this study, which it's a survey that we conducted nationally of healthcare providers, and went out to providers in most states within the country. And they represented hospitals, medical groups, long-term care, post-acute, assisted living, and others, pretty much trying to assess their views of what the major issues are in healthcare policy in the country, what they expect will happen in the future, what they anticipate in terms of politics for Washington and also from the states. So it's got a summary in the beginning, and it's got more detailed survey results in it, so I thought I'd pass it out so the board could see it. I think the big message is there is been talk for a long time about payment systems in medicine changing from fee-for-service to value-based or an alternative payment model. And that really is accelerating. And the current administration has really picked up from what prior administrations had initiated and are pushing very rapidly this concept of moving away from fee-for-service. What that means is the new payment models, I think, are going to affect how medicine is delivered. There'll be much more attention on keeping people well. As you know, a capitation system or a HMO type system is designed that way. That is an alternative payment model, non-fee-for-service. Much more emphasis on chronic disease, where much of the expense is and a lot of the end-of-life care. And this is being forced really at the national level through CMS. There's also the Center for Medicare and Medicaid Innovation. And it has authority from the ACA to approve different kinds of creative models. And there are a slew of models that are being digested and analyzed by that agency. And they're just beginning to come out, and I think we'll see some in the next few weeks, that will change radically the payment models in particular areas of medicine, whether it be cancer treatment or kidney care or other specialized areas. And that's going to really change the landscape. So I think the sense of what's happening in healthcare policy is rapid change, pretty radical change. There's, on the other hand, a strong sense that we're not going to get Medicare for all in the short term, that there's a lot of political talk about it. The vast majority of the provider community thinks that will not happen, but there'll be other changes, mostly in the value-based purchasing area. So.
Thank you.
Well, the only way to do it is with a value-added tax.
For Medicare for all, yeah.
A substantial value-added tax.
Yeah, yeah.
Okay, our next thing is our activity mindfulness break. Allie.
Allie Stewart, Director of Youth Services. We're going to do a happy memory activity. So I ask you to sit up in your chair, place your feet gently on the ground. You can close your eyes or rest your eyes at the floor. And again, this is an exercise that we're doing in Hermosa schools, part of the Mind Up parent-docent pilot that we've been working on. So I'd first like to ask you to recall a happy memory. It can be a recent memory, can be a distant memory. And reflect on some of the details of that happy memory. Where were you? Were you with anyone? Can you remember any other details of this happy memory? What kind of a day was it? What was the weather like? And now I ask that you just take 3 slow, deep inhales and exhales on your own, remembering this happy memory. And when you felt you've captured that memory, you may blink your eyes open. And just one takeaway from that, in the lessons that we're delivering through parent volunteers, we're telling the students about how recalling a happy memory can help you regulate your emotions and also combat negative self-talk. And it also can help you maintain a positive mindset. So thank you.
Thank you. Can we turn the light on up here? Community Health Committee. Vish?
Yeah, so the Community Health Committee did meet. We met on Wednesday, February 6th, 6 o'clock at the Delano Street offices. And we reviewed the Community Health Report and health priorities. And so we reviewed all the data, all the decisions around health priorities. We agreed on a set of health priorities, and there was a detailed memo of that discussion in the board packet. And we also had a, so are these, there's no presentation today, is there?
No, not.
Not unless you want Carrie Ann to come up. Carrie Ann, if you wanted to say
Not unless
anything?
you have some questions, but we don't have.
Unless anyone on the board wants to see something. But we also reviewed our advocacy policy and what that procedure is to take an advocacy position. And we also...
Wait, that's different. Was that on the Community Health Committee?
Yes.
Oh, okay.
Yeah. And it was specifically related to policies related to community health.
Got it.
And, you know, we've seen all the cities take positions on, especially not Redondo Beach, but Hermosa Beach and Manhattan Beach have definitely taken active positions on health-related policies. And so that's why we discussed it within the guise of the Community Health Committee meeting. We also had an update on the Health Fee Priority, the Drug-Free Communities Grant. So we reviewed that as well. So we reviewed the health priorities. We came up with what we believed was a good sort of consensus of health priorities. And we recommended the Board of Directors to approve and adopt those health priorities. And they've been in the packet. Shall we maybe put up a slide with them just so that everyone's clear on what we're talking about here?
I don't know if we have a slide, but we can walk everybody through what the four priorities are, which are on the first page of the memorandum, which is nutrition and exercise, social emotional health, substance use, and cognitive health.
Yeah, and the one in particular that had a lot of discussion was substance use. At first it was substance abuse, but we realized that we have an issue with youth overusing substances and using substances they probably and not having education around that. But we also have issues with adults overusing substances as well. So rather than saying, look, we're not saying stop abusing or stop using, we're saying let's have education around use because it applies to the whole population, the children as well as the adults.
I had a question about that. Thank you.
Yeah. Karen, do you want anything to elaborate on that?
No, I'm just here to provide support in case the board had any other questions about the health priorities.
The other question, I already mentioned this to you, but when I was reading the report, it sounded like the committee was recommending having objectives underneath each health priority that were crossing the lifespans, that it would be the same objective crossing the lifespans, but that's not what they meant?
No, the committee's intent was that as we assign targeted objectives for programmings under each of those health priorities, that we make sure we're covering all of the lifespan, so that there's an objective, for instance, under nutrition and exercise that covers youth, adults, and older adults, rather than focusing on just one particular portion of the lifespan.
That everybody would have objectives?
Yes.
Okay.
Yeah. And it's quite a process we've been through, right? Because we reviewed state-level data that applies to our communities, county-level data, LA County, how are we doing versus LA County, municipal-level data, our Gallup poll data, looking at all that. We had the big strategic planning half day with members of the community and their input. We took all of that, and Carrie Ann's team did a fantastic job of culling all that into a digestible presentation.
She likes that stuff.
Yeah. But to take all that disparate information and bring it into something actionable, the Community Health Committee was quite remarkable. And then we sat down and looked through, and the distillation of all that work are these four priorities: nutrition, exercise, social emotional health, substance use, and cognitive health.
So do I have a motion to approve the 2019-2021 health priorities as just stated? So moved.
Second.
I have a motion from Jane and a second from Noel. Any public discussion on the health priorities?
I would just clarify that it's 2019 to 2022.
You got that? Do we need to change the motion?
No, I think it's understood.
Okay. It's a typo. So I have a motion and a second. I have public discussion. Do I have any further board discussion? All in favor say aye.
Aye.
Any opposed? Hearing none opposed, so ordered. The motion passes unanimously. Finance Committee Treasurer's Report, Noel.
The Finance Committee, we met and we basically read it in the case. Oh, yeah. Oh, you gave it to you. Okay. Yes, the Finance Committee met
Thank
on
you, Steph.
February 4th. Save me. And we went over the financial update for fiscal year 18-19, the second quarter profit and loss. We had a review of the investment portfolio. There was a presentation and discussion of a potential action item, which was the BCHD Healthy Living Campus update, and we actually didn't do action on that. We just
Right, you gave support, but not formal action.
Yeah, it wasn't an action item, but basically that was the presentation that you guys went over. The committee agreed with the recommendation to have more Finance Committee meetings in the next 3 months as we move forward with the EIR concurrently with market feasibility and Finance Committee review, and to continue to invest and assemble the project team for the Healthy Living Campus.
Thank you. And we have a Policy Committee report and 3 items for voting from.
Yes, the Policy Committee met on Tuesday, February 12th at the Delano offices, and we had 4 items on the agenda. One of them was a discussion around appointment of high school students as committee members. We made a revision to that policy. We recommended, should I go through all of them, or are we going to vote one by one?
We'll do one by one.
One by one?
So
Okay.
let's take a motion
Maybe
on that.
just for the record, just to give at least a description of what they were.
Yeah, so there was some wording and language change around the policy. So it's policy 220, and it was about just specifying that the high school student would be somebody who's a senior or junior attending high school. We crossed out the Hermosa Beach, Manhattan Beach, Redondo Beach requirement. Is that right, Carrie?
That they attend a school in the district is crossed out. They must live in the district. They can attend a school outside of the district.
Right. And then there was a discussion around whether they should include references, and we realized there's quite a burden on the community as a whole, especially the teachers, asking for 3 recommendations. So instead we changed that to be references, and we can request a written recommendation if needed.
And we had an extensive discussion about that.
Yeah, there was. I don't think we actually came necessarily to agreement, but one side of the argument was,
How are you going to sort out the bad apples?
yeah, that was.
Well, what we came to is that they will get 3 references and have the references need to sign their application. So I can't just say Noel is recommending me. I have to actually have you sign that you are recommending me. So, and then if we want to follow up with you to get more information about that student, let's say we have a lot of students and we can't weed them out, then we can call you up and say, hey, you really like this guy over that guy? Or
So we only have to worry about the forgers.
Right.
The other side of the argument was
You just
a lot of the high school students will be applying for colleges. And
obviously
we're gonna
Vish and I
have
are
to
way more trusting than Noel.
We're going to have to do.
I'm just joking.
We did discuss that high school students will have to do a lot of work to apply for college applications, and they will have to go out and get written references. And if it's sort of a good training ground for it, if they're applying for an important position on one of our committees, they should take that due diligence and show that extra effort. But we were weighing that with the burden on community members. So
Then the teachers and the staff,
I
yeah.
understand.
So do we have a motion?
So moved to
Second.
adopt it.
Second.
And I'm just going to read the action item. The policy committee recommends approval to the board of directors of revised policy number 2220 for appointment of high school students as committee members. So I have a motion and a second. Any public discussion? Any further board discussion? All in favor say aye.
Aye.
Any opposed? Hearing none opposed, so ordered. The motion passes unanimously. Next item.
Okay, so the next item is recommending approval to the Board of Directors of revising policy number 4170, which is for service animals. So there was some language changes around the difference between a service animal and a pet, and what that approval looks like, and to clarify the language of the approval required for a service animal to be on campus or a pet to be on campus.
Did you guys talk about like the widespread abuse of these policies by people who don't really have service animals? You know.
It's a pet policy and a service animal policy.
okay.
It's
All right.
both.
Yeah.
So it distinguishes what a service animal is and what the rules are for a service animal versus what the rules are for a
Okay.
pet.
All right.
A pet that comes to the office has to be registered with us in order to come to the office.
Okay, but it's pet friendly.
It's a pet-friendly office.
Okay.
And this was a policy that we initiated many, many years ago and has made a lot of people very happy. So we just are adapting it to new rules regarding service animals and making those things clear for people.
Right. And there's language in there, if the service animal misbehaves, what the procedure is for that, if it's a distraction to others.
And that the service animal needs to be a dog, right? Is that correct?
Yes.
Yes.
The officially, service animals are dogs. We don't allow
Cannot be a
other-
ferret.
No ferrets, no snakes,
Right.
So you're anti-cat.
no cats.
But if they want to,
They could be a
bring their
registered pet,
if they want to bring their cat,
but as a
then
service
that's pet.
animal, to get the extra rights of a service animal, they have to be a dog. And that's the law, that's not us.
Okay.
We are complying with the law.
We haven't had any trouble with people having allergies, because people do have allergies to pets or dogs or cats.
We have not had that issue.
Okay.
With,
But there's
It could come up at
procedures
some
for-
time. Okay,
yeah.
there are procedures for
Yeah.
that. Good.
So just to clarify, Megan Vixie, Chief Engagement Officer. So if it was a service animal, we cannot discriminate against somebody if they were to bring it. We would have to find accommodation in different ways in order to have them in an office environment or in the district itself on our campus. In terms of, and as a pet-friendly agency, if we have registered approved pets, we would really try to accommodate that as well as much as we can.
Thanks.
So we have, do we have a motion on that one?
Motion to approve?
Second.
We have a motion and a second. The motion itself reads, nope.
4170.
Approval of the Board of Directors revised policy 4170 for service animals and approved pets. So we have a motion and a second. Any further public discussion? Any board discussion? All in favor say aye.
Aye.
Any opposed? Hearing none opposed, so ordered. The motion passes unanimously.
So the next discussion action item is the approval of the Board of Directors of revised policy number 6160 for purchasing. And there were some pretty big changes to the policy in amounts for approval. Monica, would you mind going through the overall changes?
Good evening, Monica Seward, Chief Finance Officer, Beach City South District. The substantive changes to the policy that we made was, one, to clarify the purchasing limits when we deal with physical purchases or services. So that's one distinction. We separated those. We added more clear limits from when bidding or competitive bidding is required. And we also clarified that there are certain circumstances when formal bidding is not required, like for IT services or professional services, and that's actually now written into the policy, and we added the two appendices for that. And then in addition to that, any contracts or purchases that we have that are over $50,000 will be required to have a board approval as well. So that will be brought in front of the board. And this policy was also reviewed extensively by our legal counsel.
Okay. So do I have a motion?
So moved.
Noel, and a second? Second. Second, Michelle. Policy, the motion is to approve revised policy number 6160 for purchasing. Any public discussion? Any further board discussion? All in favor say aye.
Aye.
Any opposed? Hearing none, so ordered. The motion passes unanimously. Property Committee, Dr. Noel Chun.
The Property Committee did not meet.
Okay. Ad hoc Mind Health Committee, Dr. Noel Chun.
The Ad hoc Mind Health Committee did not meet.
Okay.
However,
Yeah, do we have any
yeah,
updates on
we had a
that?
meeting at the Redondo Beach Library where the Schurzheis did an excellent presentation about dementia.
Excellent. Nice. That was part of the contract. I remember that. And I was on that committee. Strategic Planning Committee, Jane.
We haven't met, but we're working on meeting.
I answered that email.
Potentially in April, yes. Now that you've responded, we can go forward to ask the other members.
Do we need to remove any of the consent items from number 9 to speak on independently? Or can we vote on them all as a chunk? I had some typo corrections to the minutes, which I gave to Tom. Like I didn't attend the 12-day strategic planning meeting. I attended the half-day strategic planning meeting.
The 12th day.
He's missing a dash, you know. So do I have a motion to approve en masse the 4 action items?
So moved.
Second.
Do I need to read them?
No, you don't. Just
Okay.
by reference, the consent items.
I have a motion and a second to approve the consent items on the agenda. Any public discussion on any of the consent items? Any further board discussion? All in favor say aye.
Aye.
Any opposed? Hearing none opposed, so ordered. The 4 motions pass unanimously. Is there any old business? Any new business? Community committee appointments process. Oh, community committee appointments process. Marilyn, coming all the way from the opposite side of the room. Oh, Charlie, the policies in the new format did not come with the red line for me. it was
Yeah.
all one
doesn't-
color. I couldn't see the corrections.
Correct.
But I'd already read them, so I knew I was okay with that.
Yeah, but
just
no,
for
it didn't,
future.
there wasn't, no. There
Okay,
were
sorry,
no
Marilyn.
colors in our process.
Good evening, Marilyn Rafkin, Assistant to the CEO, Special Projects. And this is one of my annual special projects. Every year I come to you to talk about the community committee recruitment process. And this year, actually, we're starting a month early, so we finish earlier. So it gives you more time to look at all of the applications, and so that everyone can be on board by July 1st.
Nice.
So everything's starting earlier. And obviously, you've changed some of the committee chairs, so the paperwork will also change. So the ones that you have are reflective of the ones until today. The applications will be available starting Monday, March 4th, and they'll be due on May 6th. And just in summary, we have 9 community members who are eligible for reappointment. And in the memo, you'll see the detail of which committees they're for. We have 1 high school student who's eligible for reappointment. We have 2 community members. Let me distinguish between community members and the high school students. Community members are adults, not attending high school. And 2 community members who are terming out after 3 two-year terms. And we have 7 high school students who are terming out after 2 one-year terms or graduating. I think they're all graduating this year. So we'll miss them, and we're going to try and honor them in the June meeting, and also all the people that are terming out. Yeah,
That would be great.
I think it's been great. From what I understand, everyone's really loved having the high school students as part of the committee, so that's been
And that was
really
Jane's
good.
idea. It was awesome.
Yes. And we also have 4 optional positions open for adult community members, and 7 high school openings. And I just wanted to tell you, last year when we did our process, we've never had so many applications. We had 21 applications for our community members, adults, and 21 high school applications. We've never had that many, and it was great because we really had a lot of choice. And this year, I think we look forward to having just as many. And it'll go out, a press release will go out, and a notice will go out next week. And it will be on the website, and the website has fillable forms, so people will be able to download that form and be able to fill it out right then and there, and then email it back in. So we're really looking forward to this year. It's going to be great. You'll have hopefully great choices.
And you don't need any action from us tonight?
I do not.
Okay.
No. Any questions? Thank you.
Thank you, Marilyn.
Thank you for your continued service. You don't get to retire. Board member reports, Vish?
So I attended the Community Health Committee meeting, the Policy Committee meeting. I also had my one-on-one with Tom. I also had a finance, kind of a deeper dive into finance with Monica and Tom on the Healthy Living Campus. I attended the Hermosa Beach City Council meeting last night, just to meet and greet and see what they're doing. I actually stayed for most of the meeting, but Tom and I also presented a little bit of background on what we're doing with the health priorities and Healthy Living Campus. I also I went to the career day at Adams, which was quite interesting. And spending time at a middle school in the campus, not very accessible to most of us. But it's kind of a pressure cooker environment in there. There's a lot of kids, and there's a lot of hormones, and a lot of sort of, trying to figure out how to be a grown-up, but still clinging on to being a kid. And also I could see the amount of pressure that a lot of children have around career and what their career is supposed to be and what they're supposed to grow up to be. And so I tried to leave them with a message of aim for a job title that is called being outrageously happy. And so that was something I don't think they'd ever thought of or heard of. And I got a lot of handwritten notes from these kids afterwards, and they'd never heard a message like that. So I think there is something, as we talk about mind health and community health in our schools, to really think about the amount of pressure they're getting to be a certain way and grow up a certain way, and realizing that, I think the statistic I found is less than 20% of kids actually grow up to do what they thought they were going to do. And so realizing that, life may go a completely different way, and you can't really engineer it. And I think there's some education that we can maybe do in the school. So it was quite an eye-opener for me. And the other discussion I had was I met with Todd Lowenstein, a city council member of Redondo Beach, and then David Whitkin, school board member of Redondo Beach. And Todd had this idea of trying to focus on having a healthier way for kids to get to school. Because at least in Redondo Beach, and I haven't looked at the map in the other cities, there's bike paths and they sort of end, and then the kids are, they're biking and then they're getting dumped into very heavy
So
traffic.
kind of like a biking school bus in addition to the
Yeah,
walking school?
or this was more about hardscape of really understanding what can we do as communities to come together. If we can get the Beach Cities Health District along with the cities, along with the school boards to put a joint effort together.
Bicycle Coalition.
Yeah.
And the Bicycle Coalition as well. So getting these four entities together in a room to really think about, what are the sort of easy opportunities for us where, in my case, when my child goes to middle school, there's a bike path from my neighborhood that goes all the way down, and literally a half mile from the school, it ends. And at that point, it's traffic and angry parents and people stopping in the middle of the street and kids on bikes trying to weave in and out.
So maybe we can make that a referral to staff to see if there's anything that we can do
Yeah,
about
so
that.
that's just an idea that, I think if we all put our heads together in all three of our beach cities, there's an opportunity maybe to
Yeah.
improve
Part of
the
the
healthier ways to get to school.
Part of the bicycle master plan.
Yeah.
Yeah, okay.
But it was nice to see that there was interest from a city council member for that initiative, so.
Noah?
Boy, 2 points. As far as like the healthy way to get to school, I got a solicitation the other day in Manhattan Beach from Pacific School asking to change the street sweeping hours so that more cars can drive their kids to Pacific School and drop them off. And I'm like, wait a second. I looked it up. Manhattan Beach is like less than 4 square miles, and there are 4 elementary schools in Manhattan Beach. Not a single kid lives more than 1 mile from the school. And I mean, when you consider that kids are more likely to get killed either riding in a car or being hit by a car with all of these car congestion, dropping off kids and, to drive 3 blocks to school. I mean, anything that we could to try and improve that situation would be
Sounds like this is
would be great.
something we need to look into.
Number 2, when you talk about career day, it took me back to high school. My career day, we had Career Center. We had these little green terminals with the cursor and stuff, and you put in all your data. And they said I should be a race car driver. So
Well, you are, yes.
I believe it.
Motorcycle drive.
Yeah.
So I concur.
And did you attend any meetings on behalf of the health district?
Oh yes. Oh yeah.
That's what you're
Getting back
supposed to be doing right now.
Yes. Sorry.
It's okay.
Yes, I did. I went to the finance committee meeting. I had a meeting with Tom, and I went to the presentation of the Schurzeyes at the Redondo Beach Library. And like I said, they did an excellent job, and it was very well received. There were probably 200 people there, would be my
Excellent,
guess.
yeah. You'll go to the next one.
Yeah.
I attended 2 meetings with Tom and the policy committee meeting.
Okay, I had my one-on-one on Tom, the Community Health Committee, and just other work, I think, related to our community health, learning more about the endocannabinoid system and just how we're going to, it's an old system in our body, and how this is CBD and all of these things are going to be interacting for chronic pain. And then the final thing is, I also was very honored to be working again in a new capacity with the American Heart Association to chair one of their subcommittees on chronic disease, but also importantly, just working through kind of what we talked about earlier, what are going to be some of the innovations in health, and so looking at young scholars in towards wellness in medicine.
Jane?
Yeah, I had my meeting with Tom and had the finance meeting. Went to the state of Redondo on Friday. Saturday with a friend, I went to the library. They had drop in all these fun programs, but we went to the BCHD meditation, and with about 20 people there, and it would seem to be very well received. Today, I started the day with some of our friends in the room at the state of of Manhattan Beach. Mike Matthews, to your point, Vish said he would hope that people would not ask students where they're going to go to college, but what kind of career would they like. And so people have noted that idea of expanding what possibilities are and not the pressure of what college is very high, especially in Manhattan Beach. And then I'm going to the COG tomorrow.
COG.
Which is Council on Governments, where Tom and Lauren are going to speak.
Yeah, I'm
It's in
going
Carson.
also to the COG tomorrow.
Good, good.
Any further announcements, questions, or referrals to staff?
Oh, I also went to the social hour. That was great at Local 90, and they were actively having participants sign up for MOIs. It was quite a drive. Yeah.
Nice. Okay, we are adjourning our meeting today in honor of Rick Rasnick. He was born September 15th, 1959, died February 13th, 2019. He was a beloved member of the Center for Health and Fitness, and he was the 2018 Spirit of Wellness honoree. And the presentation at that Spirit of Wellness dinner was very moving. As a young man, he starred as the center for the San Jose State football team in the early 80s. After graduating, he ascended through the coaching ranks, serving as an offensive coordinator for the University of Utah and his alma mater before landing as head coach at the Division I Eastern Michigan University in 1995. During his tenure at Eastern Michigan, he led the team to win 20 games in 4 years. Rick passed at 59 years old. He had dementia, and his dementia was probably caused by football injuries. And I think that his story is very moving, and I'm glad to have met him and glad that we honored him, and I am honored to adjourn our meeting in his memory. Thank you very much.